So hello and welcome to my talk today, and I'm going to talk to you today about approach of homeopathy in difficult skin pathological cases because homeopathy has a lot of scope, and its scope is only as much as a homeopath can really artistically use homeopathy. I'm going to talk to you about Icthyosis vulgaris. Icthyosis vulgaris is just a case example for me to show you the real potential of homeopathy. So first let's try to understand step by step, because my today's talk is not only for my students but also for a few laymen who will be watching this video as well. So this is a little bit like how Icthyosis vulgaris will look like. This is the worst case scenario. This may not be exactly the way the patients would have it, but this would probably be a little bit of a glimpse towards it. Icthyosis vulgaris, one of the main thing is, where does the word ichthyosis come from? It means it's known as a fish scale disease or fish skin disease. It sometimes, very often, will look like this. Very often, um, patients who have this, they don't even know it's called as ichthyosis, and it doesn't cause any major problem. But this is how it looks like, and there are thoughts that it could be inherited? Could it be genetic basis to it? Could it be immunological basis to it? It's often connected to other diseases as well. Main symptoms are tile-like small scales, dry, scaly skin. Um, the scales is the main thing. Sometimes flakiness. Sometimes in a bad shape, it could be a little bit of cracks. Typically, you will see that in lower legs and sometimes in the upper limbs also as well. In the upper limbs, and they are more in cold climate more often. Normally they don't cause any major issue, but sometimes there can be a secondary infection. Optically it may not look very good, so that's what patients come from. It's a direct diagnosis. If a doctor sees it, he will be able to directly diagnose it. There isn't much treatment about this in allopathy. I'm going to talk to you about how homeopathy has a role, and for that I need to explain you what is homeopathy. And homeopathy is a science where one has to understand that it is based on three very basic laws. Now, number one law is the law of similars, which means that like cures like. This was studied by a great German doctor and a homeopath a little later, Samuel Hahnemann, who was a doctor for modern medicine, but later on he discovered homeopathy and studied it. Later on also went to different countries, Austria, and later on in Paris in France. And he came up with this idea of homeopathy, how law of similars works. And from then onwards, throughout Europe, America, even in India, homeopathy has been very popular. It is well known because it is very scientific. It has almost no side effects, and also, very importantly, it can be given along with the modern medicine in certain cases, and many irreversible difficult cases are improved by homeopathy and often cured. What is the main idea of homeopathy? For everyone else, for all other allopathic doctors, the disease is the main thing. The symptoms is a disease, but for homeopathy, disease is not only the thing that is important. We try to understand the man in the disease or the woman in the disease, where we try to understand, and our case taking is very detailed. So if you go and meet a homeopath, it would be a totally different experience for you compared to allopathic doctor, because he would be asking you a lot about yourself as a person, your general health, about your childhood, about your fears, about your dreams, how you sweat, where you sweat, how is your hunger, how is your sleep. So we try to uncover a deeper pattern within the person, and that's the main idea of understanding deeper patterns. And these deeper patterns can often be related to mind state as well. So with help of homeopathy, what it does, it acts at the immunological level. It builds the immune system so well that the healing happens from deeper within. So I'm going to give you a case example of this disease. About 22-year-old male patient met me about a year back maybe, and he was diagnosed of ichthyosis, and he had already met many doctors before meeting me, and he was referred to me by another doctor, and that's what often happens. I see a lot of cases of other doctors who refer it to me. um, He was a thin, emaciated, very, very low confidence, nervous guy, and he felt very, 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 very shaken up by the disease. In fact, he used to wear full sleeve clothes, full sleeve pants, and he felt that he used to compare himself with his brother, who was more good looking, who used to wear half shirts, and he would start the history whenever he would meet me. He would show his all photographs, and he says, "This is, you think this is curable? I don't think this is curable. I feel I'm of no use right now." He was a little bit like a worthless fellow. He felt, "I'm of no use." He felt forsaken, left out, and he felt that the relatives have totally given up on him. And there was a lot of fright within him. Felt no confidence. He said, "I have no friends. I don't make friends. I don't go out. I wear full t-shirts. I feel no one is with me. I feel I am of no use." And with this thick scales and everything like that. And I spoke to him for half an hour. I kept speaking to him every month, and I didn't see many changes in first 3-4 months of my talking to him and his history taking. Till on the third or fourth month, I really understood him, and he was this person who felt very, very forsaken, as if he's alone in the world, as if he's nothing. And that is when I tried to understand this pattern. So how did I understand this pattern? I tried to look at this in a repertory, and the rubric, let me show you. The rubric was delusion alone. Huh? She is in the world. Now there are four remedies written here. Platina, but Platina is a person with a very big ego. Pulsatilla is a person who is very, very emotional. Camphora, which is very popular in today's times, is a remedy which has extreme coldness as one of the main genius. And then my mind went to another remedy, Hura, and that's why I'm going to give a little bit of my talk about what is Hura Brazeliens and what is the picture of Hura Brazeliens. Let's see. Hura Brazeliens. This is one of the remedies. If you want to study this remedy, it is given very much in detail in the delusion chapter. So one of the main rubrics for me to understand Hura is the rubric. You can see delusion, imagination, confidence in him his friends have lost. Delusion, you can see deserted, forsaken. Delusion, beloved friend, affection he has lost. Delusion, beloved friend, he has lost her. She's about to lose her friend. So this is, we are talking about a personality who feels, and this may not be true, there will be people around him, but the main feeling is as if that no one is there with him. The feeling of absolute loneliness, deepest loneliness, extreme loneliness, feeling of no confidence. So one of the main feeling I forgot to tell you in our patient was he used to constantly feel people are laughing at him, and you will think about Baraitaka. So delusion laughing at him is very strong for Hura. He's lost, delusion lost salvation for. Even his relatives have left him, repudiated by relatives. Delusion worthless. I'm nothing, I'm absolute nothing. I'm like shit. This is what they would often feel. And this you will often understand even in the dreams, and dreams is often a window towards a subconscious state. One of the dreams you would see of Hura is dreams body parts are cut off. It almost shows your confidence level is almost is destroyed, it's cut off. Yeah? Delusion, dead bodies arms are cut off, so you can see this kind of images where they can kind of connect to dead bodies which are arms are cut off. So it's a kind of a very, very syphilitic stage where they feel that just everything is gone. Dreams of death, dreams of graves putting tapers on tombs. This you can understand, they feel very, many of Hura patients like Thuja patients will feel as if they are dying themselves. Delusion, hiding his wounds. So that's a little bit shows, it's almost a state where they have wounds and they are trying to hide it. Just a little bit state where they're trying to hide things. There's also sexuality, deep sexuality, dreams of mutilation, destruction, uh, dreams of ruins. This is the state, this is subconscious, destruction, ruins, nothing, wounds, dead bodies, dreams of walking in ruins. So this is a deeper state of Hura Brazilians, if I had to explain you. And many fears also, many fears also. fear of graves, fear of misfortune, fear of narrow places, huge fears. But the main state of Hura Braziliens is extreme forsakenness. So much of forsakenness. They get up in the morning and they feel, I have no one. And you can see the rubric, forsaken feeling, morning waking on. And they miss their people. Homesickness, nostalgia for old friends. They can be very impatient. Impatience from pain. And now they have given up on life. Indolence to work in afternoon, indolence for work with pain in abdomen. One day, Dr. Ashok Mohanty had met me and he showed me this very beautiful rubric. This I'm quoting him. He said that this is the deepest state of Hura, where they laugh at their own pain. So much of pain, so much of suffering they are going through that they laugh. So laughing at her own pain. Hmm? And because they are forsaken, they want to love everyone around him, love everybody around him, love everybody around him before and after fainting. So even when they are suffering, they are trying to give love, because internally they are vacuumated, they are absolutely empty, forsaken, destroyed. And there's a major problem with memory, mistakes that they make in talking. They forget the months, the dates, the letters, syllables. Huh? At a deeper state, Hura and Dr. Sarkar taught me this. It's a very key important remedy for osteoarthritis of the knee, because if you see in Kent repertory, cracking, ascending, cracking, descending, there's only one remedy. And he used it very beautifully in osteoarthritis. So I'm just going to give you this clinical hint. Moaning from pain is also um, Hura Braziliens. Now, why I tell you about all of this about Hura, and I'm just seeing if I could show you some symptoms of emotional weeping in Hura. So Hura has a very interesting rubric. I'm just saying, weeping in singers and public speakers, weeping causeless without any cause. This is also Hura. Now, why this is very important is because if you open Boric Materia Medica, Hura is the main remedy for leprosy. This is interesting because physically it's important for leprosy or cases where skin gets very thickened, and emotionally they also feel like a leper. And who is a leper? Leper is a person who doesn't want to be touched, who feels totally forsaken. So you can see this connection of mind and body, and he feels very like as if skin is tight, as if hide bound. And then you can understand it belongs to the Euphorbiaceae family, the main sensation of Euphorbiaceae family. You can see this hidebound is that of being bound and as if restricted, as if he's being uh, tied, as if he's being tied, straight jacket, totally restricted in life. And the opposite of this is that he wants to just liberate himself and wants a desire to break free, and motion ameliorates and wants rest aggravates. So this is Hura Braziliens, a little bit of drug picture of Hura Braziliens for my homeopathic students. So I gave Hura Braziliens, I had 30 potency, and I told you initially there wasn't much change, but recently I saw him and there's a remarkable change. And he himself can't believe, and he asks me that, can you believe I'm improved? Almost by 75%, my skin is improved and my confidence level is back. This is my email ID. If you want to refer me any cases or you want to learn a little bit more about homeopathy, you can write to me, gorangachi@gmail.com. I'm based in Mumbai. I travel sometimes to Switzerland to see patients and to give workshops, and I will be going next year to Brazil. Thank you so much.